What were the first signs that you had cancer? Story 1. My mom was losing weight. They thought it was her new diet and exercise. Turns out it was acute myeloid leukemia. She only lasted about 3 months at age 71. This specific type of leukemia is very aggressive. Answer: I also had AML, but I was 26 at the time. I was tired and had petechiae all over my legs. My now wife, then girlfriend, saw it and was like, "Go the FK to the doctor." Diagnosed and checked into hospital within 2 days, chemo for a month. They decided it was an odd form they didn't know much about, so suggested stem cell transplant, so a couple months later back in for another month for that. I had some complications that most people don't have but avoided most of the complications people do have, so a mixed blessing. I'm now 15-ish years past that original diagnosis. Minimal complications, aside from those above, and living a mostly normal life. As advice, don't freak out about random petechiae unless it's persistent. Do take the time to get your annual checkups, and most importantly, wear sunscreen. Apropos of nothing, my cancer had nothing to do with sun exposure, it's just good advice. Story 2. Lump in my breast, I felt it while scratching. I had a very aggressive tumor. I could see the outline of it when I started chemo. I am a 1-year survivor. Answer: I had a totally painless lump just above my collarbone, which I noticed when I was rubbing my neck one day. No other symptoms. It took about 2 months between noticing the lump and getting an official diagnosis, and during that time I started getting night sweats. Stage 2 classic Hodgkin's lymphoma. By the time I started chemo, about a week before the world shut down in 2020, I had masses on both sides of my neck and one in my chest. I'm cured now, but I always tell people to not fudge around with lumps where lumps shouldn't be. I hope your cancer stays away. Story 3. Severe depression, headaches, and occasionally blurry vision. Turned out to be brain cancer. Had surgery to remove a 6.8 cm tumor, then radiation and currently chemotherapy, should be done with chemo in September. Was hospitalized 30th of June 2024, had the surgery on the 2nd of July. Grade 3 astrocytoma, incurable but treatable, doing well all things considered. Answer: wishing you the best. Start my second round of chemo at home on Monday. Diagnosed brain cancer after a seizure in March. Just got back from follow-ups after radiation, and mine is looking good, but still have the hair loss and live with a massive scar across my head from surgery in April. Grade 3 blastoma, but my tumor only got to 5.5 cm when they found and removed it. Got lucky with placement, I guess, since only in the frontal lobe. Also doing well, and am back at work. Story 4. January 2019, an unexplained cough that lasted over a month. May 2019, a lump on left breast. I am prone to having lipomas, so I ignored it. August 28, 2019, diagnosed with stage 3C triple-negative breast cancer. Answer: a cough that wouldn't go away was my mom's first symptom too. It started around November of 2017. This was a woman who never got sick or called out from work, who was now constantly at the doctor. They tried inhalers, nebulizer, steroids. I knew this all wasn't normal and begged her to get her lungs checked. Turns out it wasn't her lungs, but in July 2018, they found a spot on her kidney. I'll never forget when she called me with the news. She said she'd be fine because they were going to remove the spot, and if worse came to worse, she could live with only one kidney. Unfortunately, after they had removed the spot in the fall of 2018, her symptoms returned, and right before Christmas we found out the cancer had come back and spread to her lungs and pelvis. It took her so quickly, she died in February 2019. Story 5. I woke up one morning and peed what looked like fruit punch, then noticed blood clots coming out. Turned out to be kidney cancer. Detected on a Wednesday, removed the entire kidney on the following Monday. and have been cancer-free 6 years now. Story 6. My dad had some shortness of breath while hanging outdoor Christmas lights a few days before Thanksgiving. Went in to have it checked and got diagnosed with stage 4 lung cancer. He died January 15th. Answer. Similar to my dad. It was 2020, so I hadn't seen him in person very much, but I had to stop by his place in late August to help him move some furniture. He was 70 years old at the time, but had always been in really great physical shape and always worked out frequently. And this was the first time I really started to notice his age and the fact that he seemed to be struggling with lifting and move objects more than I'd ever known him to. He was also coughing hacking quite a bit, but he brushed it off as a recent bout with bronchitis. It was definitely a smoker's cough, and he was a smoker, so I didn't think too much of it, but it was definitely noticeable. Fast forward 2 months, my sister and I get a call from him that he's had to check himself into the hospital. Wasn't sure if it was pneumonia or COVID or something else. At-home COVID tests were negative, but he was having serious breathing problems and feeling awful. Several days later, he was diagnosed with lung cancer, and within 10 days of checking himself into the hospital, it would take his life. We always felt that if it wasn't 2020 and we had been able to spend more time around him, we may have noticed more symptoms and got him help quicker, and/or he may have been more likely to seek medical attention himself if it weren't all of the quarantining and social distancing. Story 7. My dad complained that traditional dishes made by long-historied restaurants tasted funny. Stage 4 colon cancer. My mom said that Pizza Hut pizza, which has as stable a recipe as can be, started tasting weird. Stage 3 endometrial cancer. Answer. Every time a patient tells me food is tasting odd, I get nervous. Cancer isn't the only cause of taste abnormalities, but an experience in residency apparently made quite an impression. Edit. For those asking, it was a seemingly healthy guy with no complaints other than food tasting odd and feeling like something isn't right. We found he had wildly metastatic cancer. I don't recall the primary cancer. Story 8. My great-uncle went to the hospital for terrible heartburn that lasted 3 days. His wife literally substances him because he didn't think it was anything serious. He died of pancreatic cancer 2 weeks later. Answer. My mother's was a tight feeling in her chest. Took months to get her to the doctors as she put it down to stress. They gave her 6 to 12 weeks, but she kept going for 21 months. Eventually, she succumbed to a bleed on the brain, a blessing in disguise I wish took her sooner. She wasn't my mother for the last 6 months. We lost my uncle to a bike crash the year before, and I don't know what's worse. The sudden loss of a loved one, or a drawn-out goodbye, losing the person slowly. I have some of her ashes in a ring. Story 9. I had heavy, painful, and extremely irregular periods for years. I just put up with it. Normal PAPs always came back clear. Occasionally, I would pass massive clots for a few hours. This happened again, but didn't stop for days. I collapsed at work, night shift RN. After doing an ultrasound, I was operated on the same night. Diagnosis: endometrium cancer. After having everything removed, chemo and radiation, I was given the all clear. That was 16 years ago. I was one of the lucky ones. Answer: similar here. Miserable periods, though they had always been heavy and regular, that I attributed to perimenopause. Normal PAPs. Asked about an ablation with a bisalp for relief. Doc sent me for imaging, found what they thought was a polyp, got the biopsy, found cancer. Thankfully FIGO won, and since I did not want kids anyway, total hysterectomy. Ended up stage 1A, so no further treatment, just monitoring. Story 10. Not me, but my best and longest friend in life. Had trouble swallowing. Went to the doc and had stage 2, curable throat cancer. Died 6 months later due to kidney complications associated with chemo. Fudge tragic. Answer: that's one of the most aggressive type of cancer you can get. I'm sorry for your loss, but the chances were not very high in the first place. My grandpa had this type of cancer too, and he was the only one in therapy who survived that time. He ended up needing his throat dilated every month, which was painful as hell. It was more and more difficult for him to eat. At the end, he was fed via syringe through his stomach. Quality of life was not very high, if you ask me. Lots of pain and medical procedures for the rest of his life. Story 11. I turned yellow. Had been having abdominal pain for weeks, but it was jaundice and the terrible itching that accompanied it that finally convinced me to go to the hospital. I was diagnosed with stage 4 cholangiocarcinoma, cancer of the bile ducts of the liver, very rare and very aggressive. By the time I was diagnosed, it had spread to my lymph nodes. I needed a stent placed in my bile ducts because a tumor had blocked it off, resulting in my body's inability to properly drain bile. This was almost 2 years ago. I've had 2 rounds of chemotherapy infusions and am now on a daily chemo pill. I'm still stage 4. The tumors have basically stayed the same size since diagnosis. It's been a rough couple of years, but I'm still here, living well past the initial prognosis. Answer: my mother-in-law had this same cancer. One day she just turned yellow and they found a mass obstructing the biliary ducts, stage 4, everything. She got a surgery to unblock the ducts and decided to fight it, so she got the port for chemo installed. Turns out, the surgery for the ducts resulted in an infection of the plastic duct prothesis, and that's what eliminated her. She was gone in less than 2 months from the diagnosis. I'm very happy that you are well. All the doctors she saw didn't give her much of a positive outlook, as this thing is very aggressive, usually found too late. A doctor friend told me that this is the second highest mortality cancer, next to pancreatic. Story 12. No signs. I commented before on another post with the same title, but I had thyroid cancer at 25. And there was nothing out of the ordinary except that a buddy of mine saw me one morning and said, "Bruh, your neck looks fat." I was a skinny dude, so that caught me off guard, like I thought he was joshing around. And he said, "No, bruh, it looks fatter." God damn him, I owe my life to him. 40s now and thriving IDK, how he even saw it. It was nothing more than a very small and slight and soft neck swelling, like if you bump into something and get a bit of bruise. Answer: I've had several doctors over the years and I guess none of them felt my neck until I established with a new primary care physician who felt it and was like, your neck feels kinda inflamed. I guess I'll send you to an ultrasound for that. They found a 4-centimeter tumor, metastatic thyroid cancer at 25 years old. Now that my thyroid is removed, I can feel that it is skinnier, but honestly, I never noticed how fat it got, LMAO. Story 13. My sign was that I was peeing about 8-10 times a night. Doctor visit resulted in increased PSA. Scan showed intermediate aggressive cancer on the prostate. Had it surgically removed on May 14th. First PSA test yesterday, and it is now undetectable. Fingers crossed for no recurrence in the next 5 years, and we're good to go again. Shocking part of my life, but 9 weeks out from surgery, I have virtually put it behind me. Men, get tested from 40 on. It will save your life. Story 14. I beat myself up over this. I had off and on rectal bleeding for the better part of a year. Thinking about it now, it was probably longer, and it wasn't until a year ago I finally sought medical advice, thinking it was hemorrhoids. I never got physically checked out, just discussed my symptoms over the phone. Doctor diagnosed me with hemorrhoids based on what I described the color and amount of blood to be. They prescribed me a cream to apply that would shrink the issue. It seemed to work. The bleeding would stop for a time. I would stop applying the cream. It would return, rinse, and repeat. About 3 months ago, the bleeding was so bad I was afraid to laugh, cough, sneeze, and when I would go to the bathroom, it was common for it to just be blood. I went back to the doctor and demanded an in-person exam. No hemorrhoids. They ordered a colonoscopy, and the worst I thought it would be was diverticulitis or ulcerative colitis. I am finally having surgery next week and having a partial colectomy. Colon cancer has appeared in my family before, but 3 and 4 generations away from me. Genetic test was negative. CT scan was negative for metastasizing. Initial MRI results are hopeful that it doesn't exist in the lymph nodes. We will know more after removal and pathology gets to do their deep dive. I wish I would have been more proactive a year ago and requested a rectal exam, but I'm glad I caught it now. If the bleeding wouldn't have worsened, I wouldn't have done anything more. I'm soon to be 41 and wouldn't have a colon screening for another 4. Colon cancer is hitting my generation and younger earlier and earlier. My advice is don't wait till 45. Answer. And this is the exact reason when my husband told me he's been bleeding off and on for a few months that I called a gastro immediately. They just so happened to have an appointment the very next day due to a cancellation, so I called him at work and told him he must take the day off tomorrow. He was annoyed, but he did it. Doc didn't even do a physical exam. Immediately went to scheduling a colonoscopy. They told him they either have 721 or end of September, so he's going for a colonoscopy on Monday. I refuse to lose my best friend to something preventable and treatable. Has only 32 but colon cancer runs in his family. Story 15. November of 2023, I drove myself to the ER. I was very sick. They did a scan and said, "Guess what? You have a perforated abscessed stomach ulcer." I'm like, okay, what do WR do for that? Surgery, they said. So I got that done. In February of 2024, I was at work, feeling worse than before. I called my amazing surgeon and he said, among other things, that if I started vomiting, I should go to the ER. So I did. 3 days and no poops later, they decided to do a colonoscopy. My surgeon couldn't get through the blockage. They opened me up. I had a 7-hour surgery. Doc came in a day or so later and informed me I have an aggressive cancer. They had to do a colon resect during that emergency surgery. I went through 6 months of chemo, Folfox. A PET scan later, and they found a spot on my liver. A small spot, but making it stage 4 nonetheless. They microwaved that sucker and I just finished another 6-month round of chemo, FOLFIRI. I have been told how positive I am, how I amaze people with my ability to keep working and get busy living rather than get busy dying. Lately, I feel like a burden. My coworkers are sick of me, I think. My family, dad, brothers, etc., I know love me, but I feel like a burden. I don't ask for help. I go through this alone. But yet, there is a feeling that everyone would be better off if I would just go ahead and die. I'm not tragic end. But I am more depressed and feeling hopeless than I've ever felt in my life. And lonely. I gave friends and family and coworkers. But as things progress, I realize that no one actually cares that much. I live alone and I work hard and I try to connect with people. But the bottom line is, no one wants to get too close with cancer person. I did so good for so long, and now I'm tired. Instead of feeling supported at work, I feel like I am nitpicked and dismissed, and I love my job. I'm very good at it, and I help people, but now I feel like that's nothing anymore. I have no value to anyone. Anyway, thanks for coming to my TED Talk. Answer. From your post alone, you sound like an incredible person. Truly someone I would be super grateful to know and have in my life. You are just exhausted and burnt out from going through all of this alone. This alone can break down a mountain, and you are a superhuman to have overcome this. You are not a burden. You have every right to take this space. You need to seek therapy and maybe an antidepressant till you pass this. Story 16. A barely abnormal pap smear that was a requirement for my deployment to Afghanistan. 20 years of normal paps, with the last normal just over a year prior to this one. Even the GUN was annoyed that it was a requirement for a deployment and thought it was a waste of time and money. Nope. Invasive, rare, aggressive cancer of the endocervix. No symptoms. My oncologist said if I'd waited another 2 years for my PAP, as required then, I'd have been stage 4 or dead. Get those PAPs, ladies. Answer. Last time my gyno was rolling her eyes and speaking sarcastically as to why am I so concerned with my health, because I am healthy, and I am just wasting my own money with unnecessary pap smears. Because I ask for them every year, and the government only covers every 3rd year for my age. Well, exactly because of this, I don't want to find out that something was wrong and had 3 years to develop unchecked. Story 17. There were no signs. Where I live, when you're 50 years of age, you can get a free mammography every 2 years. As it is, I got the invitation of a place in Bavaria, but was in Zeldorf most of the time. So that didn't work out, and it got sort of forgotten. But in the year after that, so when I was 51, they sent me this invitation again, and this time I went. Because after all, I'd rather be safe than sorry. My parents forwarded my mail to me. There also was one letter of the mammography center. I thought, okay, I'll read it. It will say, all clear, and I'll file it away. Only it didn't. It said that 3 different doctors had looked at the images, and they all thought that this should be looked at again. Okay. About 3 weeks later, I had surgery to have a small lump removed from my breast. It had hidden itself in the very center, and not even the doctor had felt it when she palpated my breast just a week or 2 before. But there was no hiding from the ultrasound. So, I am one of these statistics that have actually profited from a mammography screen. And it was good that I didn't get around to it when I was 50, because then it would not have been there yet. Answer. Me too. I was 42 and at a routine gyno visit when my doc was like, hey, you're old enough for a screen, how about it? We have an opening today, so I was like, sure, that's the grown-up thing to do. Yep, breast cancer, stage 1, first mammogram ever. No one ever felt it with palpitations, even doctors looking for it. Anyway, after surgery, radiation, and tamoxifen, I'm 5 years Ned. No evidence of disease. Story 18. My son, 4, acute lymphoblastic leukemia. He would start crying and stop walking, couldn't stand up. 2 ER visits, x-rays, they had no idea. My oldest 2 kids' Nana was a nurse and told me if it happens again, go to kids' hospital. It did, we did. 2 hours later, told we will be staying overnight. Next morning, told our child had cancer. His white blood cell count was 3. In October, he will be 3 years in remission. The common symptoms of acute lymphoblastic leukemia is bone pain that wakes a kid up in the night, petechiae, skin, fever, fatigue. My son only had the pain in his legs. If you are worried for your kid, ask for a blood test, as they don't do them on kids routinely in emergency rooms, as it's too hard to keep a kid still. Restrain your kid. A little distress now is nothing compared to the distress of a diagnosis that comes too late. Also, please donate blood and join your appropriate bone marrow registry. Answer. I just commented on here with almost the exact same thing. My 4-year-old daughter had leg pains that were keeping her up at night, and yup, all. We were diagnosed pretty quick because the ER didn't want to send us home without getting a blood test, just to be sure. But as you know, lots of people just get sent home without it because they don't want to have to try to draw blood out of a little kid. We're 10 years out and considered cured now. Story 19. Jaw pain. My dentist told me it was likely due to TMJ, and we spent 2 months reshaping mouth guards trying to make a difference. Nope. Stage 4 oral cancer. Story 20. Literally only a lump on my breast, and I took it seriously when I was laying in bed, and gravity pulls my breast to the side and I could still feel it. I was 31. I also was very tired, but that was after the Christmas rush at work. I got it checked at the GP. They referred me to get a mammogram ultrasound possible biopsy. Did that 2 weeks later, and the same night of my mammogram, etc. I got a call from my GP. That same night, the mammogram alone showed breast cancer. If this was 3 years ago, I would have never gone to the doctor. My anxiety and avoidance would delay me going. A lot of people said, it could be something simple, blah blah, so please don't let that deter you from going because it can be serious. I'm lucky that the cancer was in the breast alone and hadn't spread. And I'm thankful my GP didn't dismiss me because I was 31 and she listened to me and checked. I was 31 and had breast cancer. Can you fudge believe that? Within a month, I had a mastectomy, and then 4 weeks later chemo, and I'm 9 chemo sessions into my treatment, and then I will start radiation, and then eventually a breast reconstruction. And I'm lucky to live in a country where I pay zero for everything breast cancer related. Thank fudge. Story 21. My uncle's only symptom was short-term memory loss. I witnessed when we were driving, he repeated himself that we need to stop over and refuel multiple times until we eventually broke down. An MRI revealed an inoperable glioblastoma. No headaches, no other signs. He died 8 months later. My dad had fatigue and severe chest pain. Doctors chased a heart issue for months before a CT revealed a 126 cm metastatic tumor, stage 3 thymic adenocarcinoma, incredibly rare and incurable. It can't be removed due to its location near the heart. Has endured multiple surgeries, 25 rounds of chemo across 3 treatments. He's still fighting after 18 months, but we're losing him. My only advice is trust your gut if something feels wrong. Push for answers. Regular checks and scans can save your life. Story 22. Severe debilitating lower back pain that would radiate into my pelvis on occasion. It turned out to be an egg-sized lymph node mass pressing on my sacral nerve endings. Then came the 6 golf balls in my neck, after having 2 nodes in my neck for 2 years that my doctora didn't think to biopsy. I had stage 3 diffuse large B-cell non-Hodgkin's lymphoma and just completed chemo in February. I've been in remission since and hope to continue to be in remission. So, if you have enlarged lymph nodes for prolonged periods, please pressure your doctors for a biopsy ASAP. Or any pain that seemingly has no explanation. They initially blamed it on my reproductive organs, despite no evidence of any of the issues they misdiagnosed me with. Story 23. Not me, my experience with loved ones. I just lost my mom, dad, and my dog to cancer. Mom, it was chest pain. Series of events to find out it was stage 4 liver cancer. She died not long after. My dog, it was a lump on his neck. He went downhill after that quite quickly. My dad had a variety of things going on and not sure if it was the cancer. His was loss of balance. It was bone cancer. This all happened from January to February this year. There was nothing I could do. Powerless. Just found out today that someone I would consider one of my closest and dearest friends has a super rare form of breast cancer. Started as a rash. It's hitting me super hard right now. All the feelings for my friend wrapped up with recent loss. My mom had cancer 3 times. The first time I was only 7 years old. I still remember where I was sitting when she told myself and my brothers, "It's something you never forget." She fought and beat cancer twice. My friend is a lot like my mom. Kind, thoughtful, funny, and very strong. I know she can beat it too. My wife and I are currently planning ways we can be helpful to her and her wonderful husband, also a close friend. My heart just breaks for him. And son, just the best little guy. Making a meal once a week, chores, being present. I've seen so many different first signs of cancer and watched people I love struggle with it. My mom always faced it head on and never stopped finding some joy. I'm going to try to channel some of my mom's joy and strength into supporting my friend and her family. Went off script on this question a bit, but was good to write it out. Answer: I am so sorry for your losses. I can't even imagine how hard and painful this must be. I'm pretty sure your friend and her family feel loved by your presence during this delicate moment. My grandma, whom I love the most in this world, is suffering from chest pain and localized pain. Doctors say it's a heart condition, but I'm quite concerned because her AST and ALT test results are frighteningly high. Would you mind sharing other symptoms your mom had leading up to her liver cancer diagnosis? Story 24. I was 21 and at university. I woke up one day with a slightly weird feeling in my throat. Cursed the fact that I probably had a cold developing and got on with things. What followed was my throat getting more and more uncomfortable. I thought it was a persistent infection and doctors kept giving me antibiotics, but also saying cryptic things like, if you get night sweats, go to the ER. After a couple weeks like this, I felt a lump on my neck. It wasn't until I couldn't swallow food or water anymore and took myself to the ER that they finally diagnosed me with non-Hodgkin's Burkitt lymphoma. I started intense chemo a few days later. This all happened nearly 15 years ago. Story 25. My 10-year-old son started to get double vision. He didn't tell us for a while because he said it didn't bother him and he didn't think it was a big deal. But then his eyes started to turn in. We took him into the eye doctor for what we thought was a lazy eye, and they sent him to get an MRI. His diagnosis was DIPG, stage 4 brain tumor that's inoperable. He passed away 7 months later. Story 26. Wife felt a lump. Had it checked by a family doctor. They couldn't feel nothing. Mentioned it again 8 months later. Doctor said they didn't feel nothing still, but she was due for a mammogram anyways at next visit due to current age. The doctor changed specialties and new doctor was assigned. She immediately felt it and said needed to get a mammogram ASAP. Stage 3 breast cancer. Fudge, that previous doctor. TLDR. Ladies, if you feel a lump, ask for a mammogram. Fudge what your family doctor thinks. Demand 1. Answer. My dermatologist told me I was too young for cancer, but I pushed him to do a biopsy of this weird mole I had because my mom was just so annoying and worried about it. Sure enough, melanoma and I was only 23. If my mom was not that pushy, I would probably be dead. I had just moved out of state to go to grad school. The mall was in a place I could not see with my own eyes, and I was truly not worried about it at all. I got so incredibly lucky that we caught it at stage 1, and all I needed was a surgery to remove the mole in a few lymph nodes to make sure it had not spread. Now I just have to go in every 6 months for a skin check. Story 27. My wife had sudden intense pain in her chest. Worse than childbirth levels, according to her. She thought she was having a heart attack. Turns out it was stage 4 breast cancer. The pain was from where the cancer had spread to her bones and lungs. She just had a mammogram too. It was clear. Turns out they don't detect all sorts of breast cancer. Story 28. I had a hard lump just above my collarbone on the left-hand side. It felt hard, but somewhat squishy, like a ripe lemon underneath the skin. It seemed like it should hurt real bad if I pressed on it a lot, but it didn't. It felt like it was attached to something in my neck and was only a little bit mobile. Right before treatment started, I began to experience tumor fevers, basically a low-grade fever, every day, usually in the afternoons. Classical Hodgkin's lymphoma, stage 2B, will be 5 years in remission as of this December. Happy to answer other questions. Stage 2, because it was only above my diaphragm, and B, because I experienced B symptoms such as tumor fevers. Thankfully, I didn't have itching or night sweats, though. Story 29. Pooped, and there was so much blood in the toilet I couldn't see through the water. I cleaned myself up, walked to the hospital, had a colonoscopy, and they found a 5 cm polyp. Had part of my colon removed and a bunch of lymph nodes. Stage 1, all good. It's been 4 years. I get yearly scans and don't give it much thought except for scan weeks. This is the 5th year and supposedly I should be in the clear if all is well in December. Story 30. My kitten obsessively licking my armpit. It led me to rubbing my armpit and discovering the lump, infected lymph node, that led to my stage 3 breast cancer diagnosis. 14-year survivor as of this week. Story 31. Acid stomach. For a couple of years, every 3 to 6 months, thought it was a dietary thing. Easily controlled with antacid chews, it went after a day or so, until it didn't. Turns out it's stage 4 esophageal cancer, metastasized to liver lymph. That was last Aug. Lucky to have remained out of palliative care for this long. Kudos to the Spanish public healthcare system, though. From the first visit to the local general practitioner, who after a week on omeprazole failed to clear the problem, took a look with ultrasound, put me in an ambulance to the local hospital. Had to wait to get through triage, but admitted at 11 p.m. At 1 a.m., duty doctor got the head of radiology out in his PJs. 1 hour later, I'm in intensive care. 2 days later, after full battery of test catheter from shoulder to liver, they gave me a full diagnosis. Prognosis assigned a consultant. Weekly visits for tests, chemo consult. I may not have long to go, but they are doing their best to ensure that it's as comfortable as humanly possible. Story 32. My wife thought she was just constipated much of the time. She tried OTC laxatives with no effect. Finally, at 54, she agreed to a colonoscopy. She didn't want anybody near her that part of her body. A huge tumor was discovered, and the cancer had already spread to her lungs and liver with no other symptoms. She died 2 years later, at 56, from liver failure. Advice: don't be afraid. The little bit of shame you might feel of somebody poking around your butt is nothing compared to chemo and its effect on the body, and surgery to remove a section of the colon and wearing a biliary colostomy bag. Not to mention leaving 2 daughters in their 20s without a mother. Darn, that was hard to write, but if it encourages one person to go get a colonoscopy, it was worth it. Story 33. My first signs were nausea, fatigue, and some serious changes in bowel movements. I lost 60 pounds, but only went down 1 size in pants. I told my doctor about it, and he just rolled his eyes. I went to a lot of different doctors. They ran tons of tests, but nothing showed up. 4 years later, a doctor finally felt something and sent me for a CT. Voila, stage 4 serous papillary carcinoma. Of course, it was terminal. Thanks to God and fantastic oncologists and researchers at Duke, they managed to find an existing medication that has kept the cancer at bay. My expiration date was in 2017. I'm still kicking and doing well. I know how terrifying your situation is. Try to stay positive. I know it may seem impossible, but try. It will get you through a lot. Story 34. I just found out today, my dad has cancer. A few weeks ago, he had a sudden huge lump appear on his forehead, and it was growing really fast. It turned out to be a metastatic adenocarcinoma. We aren't sure where it's originated from yet. But before all of this, I've noticed that he's had a decrease in appetite. I've noticed he's not as strong as he was, and he gets tired more easily, which has been unlike him. Due to his age, I thought it was related to him getting older, but it wasn't fully the case. I haven't lived with my parents recently, so I can't definitively say changes I've noticed over time. But when I do see my dad, I think looking back there were subtle changes that I noticed in him. He's lost some weight recently too. Story 35. Was a little sore below my eye that just didn't heal. My doctor said it was cosmetic and don't worry about it. It still wouldn't go away, and he said I was too young for cancer. Sent me to a plastic surgeon. It was basal cell carcinoma. I developed several more lesions and had them removed over the years. I get checked every 6 to 8 months. My uterine cancer was a different beast. There are no symptoms. The only way it was discovered was a biopsy of the uterus after it was removed in a total hysterectomy. I had suffered years with endometriosis, tried the pharmaceutical way to no avail. Opted for the hysterectomy, dodged a real bullet. Answer: I was 23 and had a mole I was worried about, and the doctor told me I was too young for cancer. It